Fight against the Mpox outbreak has been intensified in Africa thanks to a WHO and Africa CDC initiated continental approach aimed at combating the disease. Now, since the start of this year, over 22,000 people have been affected by the virus, but due to some financial constraint, many African nations cannot purchase vaccines from Western manufacturers. Consequently, of course, the WHO and Africa CDC have procured vaccines for the 13 African countries with reported cases of Mpox infections. Now, DR Congo is the hardest hit country with the Mpox disease, which has been largely attributed to the new strain detected in eastern part of the country. Now, let's have more details of that in this report.
The fight against the Mpox outbreak is being scaled up across the African continent. A strategy aimed at ending the disease, known as the One Continental Plan, has been drafted by the World Health Organization and the Africa Centers for Disease Control and Prevention.
Our organizations are working together closely to leverage our comparative advantages and to coordinate our work under one plan with one budget, as John had already indicated earlier.
More than 22,000 people have been infected with Mpox in Africa since the beginning of this year. But many African countries cannot afford to buy vaccines from Western manufacturers. The WHO and the Africa CDC have secured doses of vaccines for the 13 African countries that have recorded cases.
Now we have 1 million secured. We can be around 1.6, 1.7 million, and that one will help us to start the first round of vaccination.
90% of the Mpox infections in Africa have been recorded in the Democratic Republic of Congo. Scientists say a new, more infectious strain of Mpox that was detected in eastern DRC earlier this year is largely to blame for the rapid spread. The strain, known as Clade 1b, is mainly transmitted sexually, but it can also be spread by getting into contact with infected people. Efforts to contain the outbreak in the DRC have been complicated by an armed conflict in the country's east. Mpox is an infectious disease caused by the monkeypox virus. Its symptoms include fever, headache, and a skin rash. Many patients experience mild symptoms, but severe infections can lead to death. The health experts gathering here have not only designed strategies for ending the Mpox outbreak, they've also come up with plans to strengthen the healthcare systems of African countries so they are better prepared to deal with future health emergencies.